Namaskara. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have none other than Padma Shri Dr. C.R. Chandrasekhar. And he retired from the prestigious NIMHANS as a medical superintendent, but he has continued to work because there is no retirement for the doctors. And his favorite hobby is writing. He has written hundreds of books in Kannada and English for bringing the public awareness. And today he's with us to tell us what is delirium. So welcome, sir.
Thank you.
The person is absolutely normal. He's doing wonderful work, and suddenly something goes wrong, and then he starts acting weird, and he starts talking all sorts of things, which is he is totally confused, and then he's not in this world at all. He's in his own world, and sometimes he becomes violent. And people say tale kettide or delirium or sunny. And what is this delirium, sir? Why does it occur, and how does it occur?
It's a medical condition, an emergency condition. Confusion is a hallmark of delirium. Person gets confused. You don't know who he is, don't know where he is, don't know who are the people who are in front of him, where he is, at what time. Everything gets confused. Though his eyes open, he can talk, but talk totally irrelevantly, behaves in an irrelevant manner. Many times they become very aggressive, and then they will have a lot of hallucinations, illusions, and delusions.
Okay, all the three are there. Hallucinations, illusion, and delusion, all are there.
Yeah,
okay.
All. They may see ghosts, they may see demons, or they may hear very disturbing sounds, or
they may see angels also.
Sometimes they feel tactile hallucination. They feel lot of hundreds of ants are biting him, or snakes are crawling over his body. So this type of confusion state and illusions, delusions, and hallucinations, all kinds, visual, then auditory, then tactile, even smell. They may say something's burning. There's fire next to me. I can smell the smoke. So this type of condition is called delirious state. If you don't attend to delirious state, you may go into coma. You may go into coma, and even you may die.
Yeah, the common one step short of coma and the death.
Yeah.
Okay. So it is an emergency.
They are semi-conscious. They're semi-conscious, or they almost go to unconscious state or coma stage if you don't attend to them immediately. There are many causes of delirium. The most common cause is high fever, 102, 103, high fever.
Yeah, I have seen in children, the moment they cross 104, they become, they start talking all sorts of things and then repeating the things. Yeah, and I think old people also have that.
Similarly, old people, elderly people after 70 or 75, even moderate fever people can go into confusion state because brain is already deteriorating. Second one is electrolyte imbalance. Person has diarrhea, vomiting, or in the hot sun, he hasn't taken enough water. When I went to Gulbarga, we were warned, sir, every half an hour, you drink water. Otherwise, you will not pass urine, or you will go into a delirious state. Even age what told us. Dehydration. And then post-epilepsy. You get an attack of epilepsy, still you haven't recovered, you are going to a delirious state. And puerperal psychosis. After delivery, usually on the 5th day, 7th day, 8th day, lady was doing well, she was looking after the child, male child, everybody is happy, but suddenly she may go into a delirious state, what you call puerperal psychosis, Bananti Sanni. And people don't bring the patient to the doctor, or even they are admitted to the hospital, they get discharged and take the patient to a mantravadi or to a healer. They believe that he is the best person to bring the person out of Sunny. And head injury.
Yeah, when you said Mantravadi, when you meant Mantravadi, I remember, sir, when I was in ESI hospital, an 8-year-old child, girl was admitted for meningitis. And she had all the features, and we had done the lumbar puncture and we were putting her on treatment. But still, the parents, they said that they want to take them back. I said, don't take. If you take, the patient may not survive. Then what they did was they brought the Mantravadi only to the hospital and with the thing in his hand, in the branch of the tree in his hand, he started beating and he also got the broomstick also. So my goodness, the way they start beating and all that, it was such a torture. I went running and took him out of the ward, and then I had to bring some sense in his head, not only the parents, also this Mantravadis. I think the people should realize that science has advanced. Yeah, please go ahead, sir.
Then head injury, the site of injury, he may go into Delhi state. On the way to hospital, he may go into Delhi state because of either bleeding inside the brain or brain damage or fracture of the skull. And then addiction. Addiction, very, very common. Alcohol addiction, ganja addiction, or opiate addiction. When they don't get the required drug of their choice, they may go into what you call withdrawal state, and they go into delay state. They become very violent. I have seen one person in front of my own eyes. He admitted him without knowing that he was an alcoholic. And 3 hours later, he went to delay state and started beating other patients and started running away out of the ward. And 5 or 6 people had to go and bring him back. And later we came to know he's a non-alcoholic.
Yeah. And also, when they are admitted to the hospital for de-addiction, that time also they may go for the...
that we know at least. Here, sometimes they don't tell he's an alcoholic.
We don't know that they're drunkard.
He has brought with some other illness, and we start treating that illness. And then they may go into withdrawal state because 6 o'clock he has to take alcohol. And at 7 o'clock, he'll go into
delirium.
Delirious state. And then even post-stroke. The person has stroke, either because of clot inside or because of hemorrhage, and the person may go into delirious state. Or poisons. Many people know they swallow 20 tablets.
Datura poison I have seen, sir. Datura.
Very poisons, very state. So delirious state is a medical emergency. People should recognize immediately, as early as possible, shift them to a hospital or get a doctor to their home. And then again, doctors and nurses have to be very careful in managing a delirious patient because they may get attacked, they may get injured because the person doesn't know that the person next to him who is taking the pulse or trying to check the BP is a doctor, he doesn't know. He thinks that somebody has come to hang me, somebody has come to kill me. So, or if he's seen a nurse carrying injection, he may think that she's going to push a poisonous injection to his body and he will die. It will attack her. So, for doctors, for nurses, for others, delirious state, we should be very careful handling the patient. And the treatment is immediately tranquilizing medicines have to be given intravenously. Because IM takes long time.
It takes long time.
Orally, they don't take. And correct the root cause. Bring down the fever. Tepid sponging, paracetamol, injectable, or correct the electrolyte imbalance. Or if there is any head injury, then take measures to see how much injury, bleeding, all those issues. And then liver failure or kidney failure can lead to delirious state. So anything can be the cause of delirium. So naturally, in the emergency wards, naturally all the doctors have to be vigilant to find out what is the cause of delirium. And
so in other words, what you are saying is delirium is like a jaundice or anemia. It is a representation, but the cause is something else. So we have to go to the root cause and treat it rather than taking it as a disease. It's a
and round the clock tranquilizers. Round the clock, every 3 hours, 4 hours, we have to inject the tranquilizing drugs, either minor tranquilizers or major tranquilizers. And then sometimes even in some cases, they give anesthesia to calm him down.
Oh, yeah. They're like a general anesthesia to totally,
totally knock down the brain. Otherwise, sometimes major tranquilizer also will not work.
So that way, give rest to the brain. That the brain which is overworking has to be given rest. Okay. Yes.
Some anesthetist called, in my experience, on 1 or 2 cases, anesthetist was called immediately. The anesthetist was given to make the person to calm down. And then later, find out what could be the cause of, because emergency, violent patient can be very dangerous to himself, dangerous to others. So in this way, delirious state is a way, initially itself, if a person start talking irrelevantly with fever or with diarrhea and vomiting or he knocked down on the road, immediately people should shift him to the hospital and let the doctors attend to the person, give right treatment so that some people within few minutes or few hours they recover. Sometimes it may take 1 or 2 days to recover from delirious state. And then if the delirium continues, as I told you, brain may get damaged. And later, it may repeated delirium can lead to dementia. Anyway,
So
another day we can
what
talk about
percentage of them they make recovery and what percentage they go for the chronic state?
Almost every patient has to recover.
Okay.
You take the primary cause.
Yeah. So timely treatment is important.
Timely treatment.
Yes.
And find out the cause. That's the most challenging task for the treating team, to find out what is the cause of delirium. If you don't understand, suppose it's hypoglycemia, nobody knows that he's
glucose. If you don't give, and if you put just sedation, it doesn't. The patient will go to coma.
Coma, even they might die. So unless the cause of delirium is identified and treatment is given to remove that cause, or there is a hematoma, or bleeding is going on.
That has to be, but it has to be removed.
Do a scanning or MRI and identify the where is the clot or how it's bleeding, subdural hematoma. Because many times head injury, after 4 weeks, you may go into delirious state. 4 weeks is normal.
Because slowly they are bleeding inside and they don't realize also.
And subdural hematoma take place. And the person may go into, that's why we tell people, any change in sensorium, please bring him back as an emergency. And we give emergency doctor's number so that the person is brought back to treatment to find out the cause of delirium. So 3 weeks, 4 weeks, he was recovering from head injury. Yes.
Yes, sir. So beautifully you have explained what is delirium and what is the difference between delirium and dementia. That's a big thing. So we will discuss once again, sir. But thank you very much for explaining so nicely, so in such a simple term to our viewers. Thank you very much, sir.
Thank you.